Nagaland is likely to witness a rise in COVID-19 cases as the pandemic hasn't reached its peak in the state, according to health officials. While Nagaland Principal Director Dr.Vizolie Suokhrie expressing concern over the stigmatization and discriminations of coronavirus patients, also said that another area of worry is the acceptance of the dead body. He said that the concerned authority has issued the SOP for the proper disposal of the dead bodies and asked various panchayats and colony bodies to be rational in dealing with such situation and sought for the corporations in fighting against the COVID-19 pandemic. Speaking at a press briefing on the COVID-19 pandemic in the state, Nagaland Principal Director Dr.Vizolie Suokhrie said that on analyzing the present situation in the state, COVID-19 peaks is expected to come and cases likely to rise. The Principal Director was assisted by other officials from the department at a press briefing on 19 August at the Directorate of Health and Family Welfare, Kohima. Dr. Suokhrie also expressed with gratitude about the laudable efforts and commitments of the state despite its limited resources able to prepare and face the pandemic.
We were fortunate to start even much more earlier than many other states. About 700 PPE were available with us during those days. That was during the epidemic of H1N1, where we have some leftover stock available with us. So with that, we started using this for training purposes and also for the frontline workers, preparing frontline workers on training how to use PPE. That is how we started.
The Principal Director added that initially there were only 3 district hospitals with activated ICU. However, all the district hospitals, including Jaluki Hospital, are now ICU activated. He added that there are adequate number of ventilators and also the department is working together with the army in fighting the pandemic.
We only had 3 district hospitals having ICU facility activated. We have activated ICU in all the district hospitals, including the Jaluke COVID Hospital of Peren. We also have adequate number of ventilators available.
Dr. Vizolie stated that some of the medical frontline workers have tested COVID-19 positive, including 3 doctors, 2 nurses and 1 pharmacist. Despite that, it has not dampened the enthusiasm of the frontline workers and they have even rejoined their duties after their recoveries.
Some of our health workers, including doctors, nurses, sweeper, medical attendants, we have some few positive cases. In fact, we have 3 doctors who are tested positive and about 2 nurses and 1 pharmacist and few sweeper and medical attendants. Those are positive.
However, the Principal Director expressed concern over the stigmatization and discrimination of the patients at the community and village level. He said that about 95% of the cases are asymptomatic and that it can be treated at home. He also said that another area of concern is the acceptance of dead body. He said that the concerned authority has issued the SOP for the proper disposal of dead bodies. In this connection, he had asked various panchayats, colony bodies and other bodies to be rational in dealing with such situations and sought their cooperation.
Once someone died, the most important thing you have to do is don't touch the dead body unnecessarily. Once it is sanitized and put it in the coffin, there is nothing to worry about it because the virus is not going to fly from the dead body to the people who are surrounding.
Dr. Vizolie also reiterated that there is no community spread in the state and asked people not to panic. He said that they are able to trace all contacts and contain the spread of the virus. Principal Director also informed that Suokhrie has its first positive case in the district. As of Thursday morning, Nagaland reported 3,558 coronavirus cases with 1,838 positive cases, 1,706 cured or discharged with 7 deaths so far. With Inzan Bimukuvo, Kohima.